Hi everyone, this is Dr. Mike. Welcome to my channel, Health Talk by Doc Mike. This is part of our health promotion and awareness. And today we will discuss the uses and side effects of metformin. And if you're new here in this channel, please do like, share, and subscribe. And if you missed the previous episode, you can always go back and check our library. We have almost 300 plus videos, health videos for all of you. As I have mentioned, we'll discuss today the uses and side effects of metformin. I believe some of you are familiar with this medication. Metformin is an oral diabetic medication that helps control the blood sugar levels. This is a chemical structure of metformin, and specifically the class of metformin is under biguanides, and it is the first line medication for the treatment of type 2 diabetes, particularly among individuals or patients who are overweight. Metformin, as I have mentioned, is used together with diet and exercise, which we can improve body sugar control in adults, specifically for patients with type 2 diabetes mellitus. Metformin is sometimes used together with insulin or other medications, but it is not for treating type 1 diabetes. Remember that the mechanism of action of this drug, it would decrease the liver glucose production. It also decreases the intestinal absorption of sugar or glucose, and it would improve the sensitivity or the insulin sensitivity by increasing the peripheral glucose uptake and utilization. For all the viewers watching, metformin doesn't cure diabetes. However, it only helps our patient or client to lower down the blood sugar level to a safe range. Metformin is also used off-label to treat polycystic ovary syndrome. If you want to know more about polycystic ovary syndrome, you can check my library about PCOS, which we discussed in previous months. For the viewers out there watching today, metformin works by reducing the amount of sugar or glucose made by our liver. It would also decrease the amount of glucose or sugar your body absorbs, particularly for people out there who loves to eat carbohydrate-rich food. Also, metformin increases the effect of insulin in our body. Metformin exists in the following brand name: Glucophage, Glucophage XR, Fortamet, Glumetza, and Riomet. Moving forward, this medication or this drug is administered and should be taken with food. So for the people out there, remember that this medication, metformin, should be taken with food. In terms of uses, this medication, metformin, is used to treat high blood sugar levels caused by type 2 diabetes. Before we go to the side effects, remember, you should not use metformin if you are allergic to it or if you have the following conditions: severe kidney disease or metabolic acidosis or diabetic ketoacidosis. If you need to have surgery or any type of x-ray or CT scan procedure using a dye that is injected into your veins, you need or you may need to temporarily stop taking metformin. Tell your doctors if you have ever had the following: kidney disease, high ketone levels in your blood or urine, heart disease or congestive heart failure, liver disease, or if you also use insulin or other oral diabetic medication. The common side effects of metformin are as follows. Patient may have stomach problems, diarrhea, nausea, stomach pain, heartburn, and gas. In terms of the serious side effects of this medication, patient may develop lactic acidosis. This is a dangerous buildup of lactic acid in your blood, and this may be more commonly or likely if you have other medical conditions like a severe infection, chronic alcoholism, or if you are 65-year-old older. Or you may ask your doctor about the possible risk. Lactis, Lactic acidosis is characterized as follows. Patient may fear tiredness, weakness, unusual muscle pain, troubled breathing, unusual sleepiness, stomach pains, nausea or vomiting, dizziness or lightheadedness, slow or irregular heart rate. Follow your doctor's instruction about using metformin. If you are pregnant or you become pregnant, controlling diabetes is very important during pregnancy. And having high blood sugar may cause complication in both the mother and the baby. You need to tell your doctor if you become pregnant while taking metformin. Because metformin may also stimulate ovulation in a premenopausal woman and may increase the risk of unintended pregnancy. You should not breastfeed while using this medication. Metformin should not be given to a child younger than 10 years old. Some forms of metformin are not approved for use by anyone younger than 18 years old. How about hypoglycemia? Because this is also considered one of the serious side effects of metformin. As I have mentioned, metformin would lower down your blood sugar. Excessive use of metformin, or sometimes patient may take this medication by over the counter. They could just buy this medication without any prescription from the doctor. They may suffer hypoglycemia. And hypoglycemia is characterized as follows. When your blood sugar goes down, you may experience headache, weakness, confusion, shaking or feeling jittery, drowsiness, dizziness, irritability, sweating, hunger, and fast heart rate. There are times our patient or clients may experience the following serious side effects. And this is a manifestation that the blood sugar level goes down. And this is referred as hypoglycemia, particularly if you do not take any meal and then you are so busy with your work. So remember, the serious side effect of metformin is hypoglycemia, when the low blood sugar of your patient, client, appear and would experience the following signs and symptoms. In terms of warnings, for people out there, before taking this medication or when you are taking this medication, metformin, always remember the following warnings. Okay? You should be aware that metformin may lead to the following: substance use disorder, patient may have liver disease, severe kidney issues, or certain heart problems. Though extremely rare, you may develop lactic acidosis, as I have mentioned. And if you experience this and some of the problems listed on your screen, you may consult your doctor or may get emergency medical help if you have unusual muscle pain, trouble breathing, stomach pain, dizziness, feeling cold, feeling very weak or tired. So remember, before taking this medication, you need to always ask your doctor. Do not self-medicate. Another information about metformin. How should I take metformin? Take metformin exactly as prescribed by your doctor, following all the instructions given by your doctor, the directions, prescription label, read all medication guides or instruction sheets. Your doctor may occasionally change your dose from time to time. Use the medicine exactly as directed. Take metformin with a meal unless your doctor tells you otherwise. Some forms of metformin are taken only once daily with the evening meal. Follow your doctor's instructions. Do not crush, chew, or break an extended release tablet. Swallow it whole. Measure liquid medications carefully. Shake the oral suspension before you measure a dose if it's in liquid form. Use the dosing syringe provided or use a syringe or medicine dose measuring device, not a kitchen spoon. Some tablets are made with a shell that is not absorbed or melted in the body. Part of this shell may appear in your stool, so don't be afraid. This is normal and will not make the medicine less effective. Some patients may experience low blood sugar or hypoglycemia and feel very hungry, dizzy, irritable, confused, anxious, or shaky. To quickly treat hypoglycemia for our patient, eat or drink a fast-acting source of sugar. For example, fruit juice, hard candy, crackers, raisins, or non-diet soda. Your doctor may prescribe a glucagon injection kit in case you have a severe hypoglycemia. Be sure your family or close family members or close friends know how to give you this injection in emergency cases. For viewers watching, the blood sugar levels can be affected by stress, illness, surgery, exercise, excessive use of alcohol, or people skipping meals. Ask your doctor before changing your dose or medication schedule. Metformin is only part of the complete treatment program that may include diet, exercise, weight control, regular blood sugar testing, and special medical care. You need to store this medication at a room temperature, away from moisture, heat, and light. Also remember, your doctor may have you take extra medication like vitamin B12 while you are taking this medication. Take only the amount of vitamin 12 that the doctor has prescribed you. If in case you miss a dose, take the medication as soon as you can, but skip the mixed dose. If it is almost time for the next dose, do not take two doses at one time. How about when certain cases, like what happens if I overdose? Seek emergency medical attention. An overdose can cause severe hypoglycemia or lactic acidosis. In taking this medication, metformin, avoid drinking alcohol. It lowers blood sugar and may increase your risk of lactic acidosis. And if you develop the serious side effects or signs of allergic reaction to metformin, because there are some patients who are allergic to metformin, they would manifest some kind of skin rashes, skin allergies like hives, difficulty in breathing, swelling of your face, lip, tongue, or throat. So you need to stop the medication and seek emergency medical help. Some people using this medication develop lactic acidosis, which may be fatal. So you need to go to your physician or get emergency help. So you need to take note of the unusual muscle pain, feeling cold, trouble breathing, feeling dizzy, lightheaded, tired, or very weak, stomach pain, and vomiting. I hope that you have learned so many things about our discussion about the uses and side effects of metformin. Remember, if you would want to take this medication, please be sure that the doctor or you have discussed your case with your personal or with your attending physician or doctor. Do not self-medicate because of the serious or possible side effect of this medication. Your case may be different with another patient. So do not listen right away to your neighbors or to your friends. Just go and visit to your physician so that he or she may give you the proper instructions if you are suffering from type 2 diabetes. Once again, this is Dr. Mike. Stay healthy, stay happy, and be safe. See you again in our next episode. Thank you so much. Please don't forget to like, share, and subscribe. If you know that this episode is very informative, please do share to your friends or to your family members so that they would be aware about the uses and side effect of this medication, metformin. Thank you very much and see you again soon.